what were you doing all this while? You started 5 years ago. And I'm like, oh, like you waited 5 years before you actually came in for a consultation. It's not for only old people.
Great. So utilize physiotherapy even as a young person.
So you should.
Move on to the next. Physiotherapists just give massages.
This one, I have a personal.
Almost far.
This one is a personal vendetta for me, because I know how many times somebody will come and say, "Oh, I just want a massage," and I always say, "I'm not a masseuse." If you want a massage, go to the spa. I think there are people there that do that. Now, physiotherapists give massages. Yes, I mean we did manual therapy in school. There was like the manual therapy one for you to know how broad manual therapy is. And then like we actually did like the practical classes. There are even the videos. So like we give massages, but it's therapeutic massage. We were taught how to do this thing. Like for example, now I'm treating someone that has facial palsy or Bell's palsy. So that means I'm going to be doing my skin rolling and I'm going to do my effleurage. I'm not just going to go there and do anything. We were taught the particular massage you need for each condition. So it's not just going in there to just go and rub somebody's body or something. Every condition has something that was, okay, this is what you're supposed to do. There are some cases where, okay, what you're doing here now is knuckling or kneading, stuff like that. So if you feel you need a massage or something, you can go to the spa, you understand? But what we give is therapeutic massage based on the condition or ailment this particular person has. It's a form of treatment because it mobilizes the soft tissue, it improves circulation, and it reduces pain. This one is a big one because there are some people who come in and when you actually do the massage, like the proper one you're supposed to do, it actually relieves a lot of pain. So it's a therapeutic thing. It's a modality we use. The same way maybe we use the ultrasound. Massage too is a modality. So it's not just you just wake up and feel like, my body's paining me. Let me just get a massage from a physiotherapist. No, that's not how it is done.
So the therapeutic massage is it the same as deep tissue massage?
Not necessarily. Deep tissue massage is a type of therapeutic massage. And trust me, what they call deep tissue in the spa is not deep tissue. They think deep tissue has to be painful.
There's something they call deep tissue in the spa. Yeah. Sorry, I've not gone there before.
I know. You hear people say they went to the spa for deep tissue massage. But that's the thing.
It's not.
What they do there is not even the deep tissue massage.
Okay.
Deep tissue massage is a type, like the effleurage and the skin rolling and the rest. But there's a particular condition. For example, now someone who someone who comes down with knee osteoarthritis now. Okay. Someone who has knee osteoarthritis. Clearly there's a degeneration going on there. And then for some of them, most of the elderly women I see, or women, not like men don't have it too, but not that like a lot of people I see with knee osteoarthritis, they are a bit obese. So there's a lot of fat around the knee. Okay. So that's when the deep tissue massage is needed because you're dealing with a lot of fat. And when we were taught these massages, you're taught how to pick certain muscles that you're targeting. Those are the spa, they don't do that. So you're going in there to pick muscles, so you actually have to know how to like the fat, deal with it and get to what you're trying to get to. So what they call deep tissue there is not actually deep tissue, but then that one is for another day.
Okay, so please, a spa is different from a physiotherapy clinic.
Yes, a physiotherapist is not a masseuse. It's not. It's two different things. I didn't get a license to come and be giving you massage.
Alright then, so let's move on to the next. We are actually in number 8. So that all physiotherapists do the same thing.
Well, we were all taught with the same curriculum.
Okay.
We are all doing the same classes. But we don't do the same thing. Trust me, even me alone, 2 patients now, they both have, let's say, spondylolisthesis. I might not manage them the same way. Do you know why? Because at first, I will use the normal spreadsheet. This is what someone that has spondylolisthesis is what you do. But you realize that along the lines, pain threshold is going to influence your management because this person's pain threshold might be higher. Another thing is recovery speed. Recovery speed might also like influence this thing. So we don't do the same things. Yes, we're taught the same way, but each patient has a different, let me say, you're managing each patient differently. So that means even you, the physiotherapist now, like you're doing different things for like this person. Someone might manage someone and I'll come in and maybe for some reason I'll use a different approach. So we all don't do, yes, we're all taught the same curriculum, but trust me, the way this person will manage is not how I will manage.
Okay, wow. I think I'm actually quite surprised about that because I used to also think as long as the person's condition is the same, two physiotherapists handling the same person will just be the same thing they're doing.
Okay. Let me actually use maybe a particular patient to talk about this now. Let me say, like, for example, now, that's the thing. All of us, we've been trained. But some people now, for some reason, there are some things they actually believe works more for them. Exactly. So, like, it might be the same condition. But yes, all of us that's the thing now. We've been taught that you can use this to handle this. You have a lot of modalities at your disposal to handle this. Now, people might have their reason for certain preferences. Do you understand? Like me, I like cryotherapy a lot. Because I've seen, like, it's not as if maybe for every company. I'm just saying, when I mean cryotherapy, it means like for most conditions, not all of them, clearly, not everything needs cryo. But for most conditions, I feel like after that, and especially when I was in final year, there's this clinic I was just like going so that I'm not, because I was doing 2020 COVID lockdown. We were at home. I didn't want to be idle, so I was going to this clinic then. And the man, like, he trained in the UK. And he believes that, like, like after every session, he would always tell me to, like, put the ice pack there. Basically, you've done a lot of things for these patients. So you're trying to calm the muscles and everything there. So that when the person leaves, there's no pain, person is relaxed. So me now, that's a belief I have. Someone else might not have that belief. So I might handle someone now, and after the treatment, like, okay, the woman that came in today that I assisted the physiotherapist here with. Okay. So normal, she was really used to like what I do for her. So when we finished and then she was like, we're done, she's about to go. I was like, oh, what of the ice? And I just smiled because she knows it's something I'm used to doing for her, that after everything, I would still use that ice there for like 10-15 minutes depending. So I had to get the ice because she was already used to it. Now that's the thing, she might go to another person now, the person might not be doing that. It doesn't mean the person is not doing the right thing. Exactly, the person now might not do the ice, she now might not think this one no waiting in the do. That's what brings about all these things.
Yes, that it also brings about this whole issue of preferences. This doctor must be the one to see me.
Exactly.
Because they feel
like this is the person. Exactly. So, like we are taught the same things, but we all don't do the same thing.
Yeah, so the next thing we have now is a patient needs only one session with a physiotherapist.
One session with a physiotherapist. Anyway, depending on the condition. But like I said, if you're sick, you're down with an ailment and you come in, clearly you need more than one session. But if it's just, like you just want all these body adjustments and all that, well, that's a totally different thing. So basically, you cannot just do one physio session and be fine. No, it's not a thing. So you need more than one session. Thank you.
All right, noted. So the next one is you can do physiotherapy on your own.
Really?
Like you don't have to go through the four walls of the university.
I mean, like you just wake up and you just do physiotherapy on your own. So like basically, why did I have to go to school? Please, you can't do physio on your own. No matter what it is you see there. I remember one time when I was treating a patient and I was trying to do the neck mobilizations. And then he was like, okay, so you just hold it. I told him, you don't just hold it though. There's the cervical spine, there's a C1, C2, C3, C4. C5, C6. We're told this is where you're supposed to go in. We're taught these things. I remember when I was still like, let me say, I was still in school then. So when they taught us the whole like spine and everything, that time during lockdown, the clinic I told you I went into, Dr. Chike took it upon himself to make sure I could identify every part of the spine. Like if they tell me, so it's at T7, I know where T7 is. normal people don't like, the layman doesn't know all those things. When someone is like, oh, it's at L4, L5, I know where L4, L5 is, so I'm going there. You can't do physiotherapy on your own, please. There's a lot of things, like, I can't even begin to explain it. But if you do it on your own and then maybe something happens, you will pay me to now do the correct thing. Just know that, sha. So
wow. So to avoid more complications.
And then another one is one of those who go to traditional bone setters. Okay. Now, don't get me wrong. There are a lot of people who actually do it correctly, but I think it's the old ones. These modern day ones, they don't really know what they are doing. So you see a lot of cases, especially when we're doing internship, when we're in you see it in pediatrics, in orthopedics. They will go to the traditional bone setters, they will do whatever it is. It will become worse. Then they will now come down to us and for me to now do the magic. Why didn't you come at the first time? So, that one is another thing. Basically, you can't do physiotherapy on your own. That is all I'm going to tell you. I might prescribe the exercise to you, but that's it. You've been doing it with me, so you know how you're supposed to do it.
You'll be properly guided.
And sometimes, even when you've been doing it with them, I know my patients who come in and I'm like, okay, let me see what you're doing at home. And I'm like, God, that's not what I showed you. Like in my mind, though. So you now have to like walk them through the whole thing again. So I mean, these are people that have been doing their sessions, and the exercises, they're still lagging in some places. It's just a minor stuff. We know what the form is supposed to look like, so it's not a big deal. But you can't do physio on your own. Go and get proper physiotherapy.
Please go and get proper physiotherapy. Yeah, so get a physiotherapist so they will guide you on how to go about your exercises. I'm learning too, right? I'm dishing out something.
Of course.
So let's go on to the next. The next is surgery is the only option.
Well, first of all, I would like to say it depends on what the condition is, and it depends on the level. Let me take, for example, scoliosis. Scoliosis, let's not delve into it because it's a broad topic, but I'm just using that one as an example. Now, there's a degree of scoliosis that will be there. The physiotherapist, will tell you need to go in for surgery. That's 45 degrees. Once it has gotten to a 45-degree deviation, there is no physiotherapy I want to do that is going to correct that. You need to go in for surgery first. They will correct. Then you now come back for your physical therapy, which you must come back for, because if you go in for the surgery and you don't do this one, whatever is happening there will still be happening. It's like those who come down with quadriplegia or paraplegia. The surgery has to be done first. So it's not like surgery is the only option. We work hand in hand with these people, especially when you're in the neurosurgery, the orthopedics, these branches. So basically, like, the surgery is done, and then you come in and do the follow-up. So it depends on the condition. It depends on degree. Like I said, the scoliosis now, that's like the level of the stuff. Also with slipped disc, it depends on, like, okay, that is why you're doing the MRIs and stuff like that, so that we know the level of like deviation and all that. So we know, okay, you need surgery. There's a level that it will be at. You don't necessarily, just physiotherapy is fine to take care of it. Same thing with knee osteoarthritis. There's the level of osteoarthritis someone will have. The person has to go in for surgery. So, and we're actually very honest with you. We'll tell you this is what you need to do. So you go for your surgery, then you come back and do your physical therapy. But it's not like surgery is the only thing, because funny enough, most times after your surgery, you still have to come back for physiotherapy. Most times after your surgery, you still have to come back. So, and then there's some patients that'll tell you, okay, since I'll still come back, let me do only physiotherapy. You now explain to them that it doesn't work like that. You have to go in and do that one. They will do their own part. Then you come back, and then we will now take it up from there. So surgery is not an only option. We work hand in hand, depending on the level, depending on the ailment, and depending on, basically like the person too. Because there are some times when maybe surgery might be an option, but this person is already too old, and you know that the surgery might come down with complications. So they are advised to just do physical therapy to manage their symptoms. So yeah.
All right, I want to believe you're learning a lot, because I am too. So yeah, we have actually come to the 12th one. That's the last one, and that is, you need a doctor's referral to consult a physiotherapist.
Well, like I said, we all work hand in hand. There are some times when you go to the doctor and there's a condition, and the doctor will tell you need to see a physical therapist. Trust me. There are some conditions that, not to brag or anything, but it's only physiotherapy that handles it. there is nothing the doctor wants to do for you. So there are some conditions like that, like the cerebral palsy for babies. There is nothing the doctor wants to do there. Like, we work hand in hand. Clearly, he's going to be prescribing the drug for the babies and telling him to come for the checkup for possible seizures. But he'll always tell you that physiotherapy is your best friend right now. So there are some cases where you go and they refer you for physical therapy. We work with them. We get the referrals. But that doesn't mean we don't make our own diagnosis. There are some times that they might even make a referral to us. And we'll look at it and realize that this person actually needs this or this. So we make our own diagnosis. We were also like schooled in such a way that we know the signs to look out for. So basically, you could just walk in here without even going to see the doctor. So you don't have to see a doctor first before you come to a physiotherapist. If you think this is what you need, you can come in and I'll make my own assessments. And then I can tell you, okay, this is what you need. And trust me, if you still need to see the doctor, then definitely I will tell you, okay, you need to. And it will even help because I can now tell you to go and see a specialist. Maybe a cardiologist, a neurologist, or an orthopedic surgeon. So we make our own diagnosis. We mustn't always get the referral from the doctors before we treat or something. So you can walk in, we'll look at you, do the assessment, do all the whatever, give you the diagnosis and then tell you if we're the ones that will be seeing you or if you need to see another specialist or something. I remember there was one time that was like the clinic I just go to. So there was this girl, she came in, I was seeing her. Normal, you're seeing someone and you're just talking to your patient. Like she was already coming for something else. She had another ailment, so we're just talking. And then she no normal conversation. And then she now said she had not peed since 4 a.m. I looked at the time. It was 12 p.m. in the afternoon. No matter, I know some people don't drink water, but even if you cannot tell me you've not urinated from 4 a.m. to 12 p.m. So immediately I started asking her like some particular questions because I suspected cauda equina. And it was cauda equina. So immediately she was rushed in for surgery because cauda equina is immediate surgery. It's not let's book. They're doing the surgery immediately. So that was like a diagnosis that I made. So we called, I told the chief on ground that see what's going on. And then we called in the hospital that was close by. Luckily, they do surgeries. And then she was taken in for the surgery. And after that, she resumed her physical therapy for the cauda equina and all. So basically, that was even a diagnosis I caught just because I was communicating with her, not necessarily that she even came in to ask me anything. So we too were trained to make our own diagnosis. So you don't always have to see the doctor before you come to us. You can walk in and we'll let you know.
That's really interesting to know because I actually didn't know this. Yeah, it always looked like you were subject or something like under a doctor. No. A doctor has to necessarily refer someone to you before you come.
Not always. No.
Wow.
The referrals can come, yes, we work hand in hand, but you can walk in and then we make our diagnosis. And sometimes after the diagnosis, we're even the ones sending you to go and see the doctor.
Exactly. Wow, really work hand in hand because a physiotherapist can also refer
someone
to a doctor.
We do it a lot of the times.
Oh, that's amazing. So I think there is one issue I would want to talk about. We had this patient whose son, I think he had a fracture or something.
Okay.
He went to the clinic. I can't remember what they did. Maybe they gave him medications, but they didn't refer them to a physiotherapist.
Oh.
And the mother, maybe by virtue of being enlightened, just thought, okay, this boy needs physiotherapy to manage it and get the complete healing. They brought him. Initially, I think his hand was hanging this way.
Mm-hmm.
He couldn't stretch. He couldn't move it.
Post-immobilization stiffness.
Yeah, I know when you were defining physiotherapy, you talked about we taking note of that mobility.
Yes.
So he couldn't. He couldn't move. It was after they started their sessions. I think after 6 sessions, the boy was able to move. We didn't tell him he's a little boy. He should put up his hand, and he puts it up, and he drops it down. So I'm like, so why do we have issues where is it that the doctors are not well enlightened that there should be like a follow-up on certain conditions by
the thing
referring
is,
their patients
to excuse some doctors are not knowledgeable. I don't know, the medical schools need to do better. Because funny enough, we're all there together. So like it shouldn't even be a big deal.
Exactly.
They need to do better. Some of them, they don't just have the knowledge. They don't know when physiotherapy comes in. So they don't even know. I remember a particular case we had when we were doing internship. There was this particular doctor who was always sending us referrals, even when we need it and when we don't need it. So sometimes the patient will come and we'll now have to be like, this is not a physio case now. We'll now send it back. So him now, he was just sending referrals because he felt after he's done, physio will continue that knowledge thing. Then some, they don't even send at all because they don't know when physiotherapy comes in. Then some, it's a war thing, because in this country, like, I don't know whether it happens other places, but I'll talk about where I am. It's always a thing. The doctors are saying this one is not important, this one, I don't know, there's always some kind of like background work going on. You'd hear people, some doctors, they will tell their patients, you don't need physiotherapy, they don't do anything there, as if like, and then you know, honestly, a lot of cases, then somebody will now, patient will come in and they'll get better and they'll be like, but my doctor was telling me I don't need this. I had a patient who legit was lying to her doctor because she said she couldn't even tell him she was doing physical therapy, that he told her to just go home and she'll be fine. So she was doing physiotherapy and she said she was getting better. So when she goes, she'll be like, you're doing well, ma. She should not be like, hey, I'm just, because she couldn't even tell him she was doing physiotherapy. Why should she be scared to say she's doing physical therapy? It doesn't make any sense. So some of them don't know, that is excusable. But some of them, it's a war thing of like, no, I don't want to send the referral to physiotherapy. But you're forgetting that you're not doing the patient a whole lot of good.
Exactly.
It's better you send and the person doesn't need it. Like the one during my internship. Yeah. We did not even mind. We even became friendly with the guy. Better you send and we're like, okay, it's not our case. It will even help you learn when we come in and when we don't come in. Since it's not actually a thing that they teach you guys, because it should be a thing. I don't know why there's the whole...
Yeah. I mean, it's not necessary.
It's really not, it's not that hard. I mean, because even we send in these referrals. There's a case of a man that came in and he was saying that his back, this one. After the whole assessment and all, I actually told him to go and see a neurologist first. Okay. Then after he's done and all, let's hear what the person had to say, because I was suspecting prostate cancer. Him now, you know, they tell you don't Google your symptoms. So he had Googled the symptom and he came and said he has sciatica. So that's why he came here. And funny enough, he actually went and it was prostate cancer. So imagine if me now as a physiotherapist I had said it's sciatica and I don't want to refer him. That's how we'll be there managing sciatica that I know that he doesn't have. But I sent him into the neurologist and then they went in and now he's feeling a whole lot better. So and he actually thanked me a lot for that. Definitely. So we all work hand in hand. Then they taught us it's a multidisciplinary approach. Nobody is trying to take anybody's job. You do your own part and I do mine. And at the end of the day, like all of us, like we're still helping these patients get better.
That's the purpose, to help humanity. So by the time we are struggling and we're trying to get this over this, I mean,
exactly. So you can send a referral. I too can refer you. There are times when we even write these referral notes. We even refer to the radiologist sometimes because we're like, we need to check for this. So we send them to get MRIs. So that is the thing. Like all of us, we can't do it. Sometimes you refer to the lab. Tell them to go and get this done. So I'm not telling them, oh, you don't need to do that. Let's just, because I feel like this is what the patient should get, a holistic care. That's the point. That's why there are subsets. Doctors, nurses. No one person is managing everything. So yeah.
Please, let's do better. Let's work as a team and achieve the goal that we ought to achieve. So wow. Thank you so much.
You're welcome.
We've successfully clarified 12 myths about physiotherapy.
Yes. So don't ask us for massage.
And the many other things. So please, the fact that we've even talked about 12 and you're saying there are more, I can only imagine.
Exactly.
So if you've listened to this, I want to even congratulate you. And from this, you must have known that there's a lot that comes with physiotherapy. Physiotherapy is beneficial, and I know one thing with these myths is that they can limit one from getting the benefits. They're always like, oh no, I can't do this for this, I can't do this one, I can't do this one. When you've not even confirmed, you've not asked questions. You know, I think another thing I learned is that we shouldn't assume.
Yes, assumptions.
That thing is costly actually. So just walk into yes, this is amazing physiotherapy. You can walk into our facility. Tell us you want to see a physiotherapist. We get a time for you. If the physiotherapist is busy, we can book an appointment for you. You see a physiotherapist, talk to the person, get your diagnosis, we even offer free assessment. So you can utilize the free assessment to see a physiotherapist. If you can't do a walk-in, you want to book an appointment before coming, you can check us up on our website. Our website is www.amazingphysioclinic.com. You can check us up there. There is a place where you can, go to book an appointment. There are phone numbers you can even see to call to get a time. We have different branches at Lagos, Port Harcourt, and Abuja. Please, no assumptions, and really, we want to help you get better. We want to help you live a pain-free life. So no assumptions. Your physical health and wellness matters a lot to us, and that's one of the reasons we are hosting such podcasts as this, so that you
and it's
learn.
free. We're not asking you to pay for it.
Totally free. All you need is your data and of course your phone. Totally free. So please maximize this opportunity. Physiotherapy is another branch in the medical world, right? Maximize it. They all have their specialties. Physiotherapy has what they do, and it's a lot. So thank you so much, doctor, for all of these clarifications.
You're welcome.
I also got cleared on some things. I would say I had my own meat. It's allowed. I had my own meat.
It's allowed.
I know that it's even common in many other fields.
Yes.
There are misconceptions people have about the law firms, and banking and
all
the rest
those
of
things.
them.
Yes.
So please, let's not keep ourselves limited, right? Yes. So with this, we have come to the end of this episode of Physio Nextdoor podcast. Thank you so much for joining us. If you have not subscribed, please.
What are you waiting for?
Please subscribe. We have more enlightening and engaging content that will be coming up. We've done 2 earlier, and that was on back pain and neck pain. You can check it out. Also ensure to like and share our content. This may be a huge eye-opener and deliverance to your neighbor, your friend, your loved ones. And this podcast is hosted by Amazing Physiotherapy Clinic. So you can also follow us on our social media handles. We also post amazing content there. Check us on Facebook, on Instagram, and on Twitter. Yes, at Amazing Physiotherapy. And you will be glad you did. You'll come and thank me later. Don't worry. Alright, once again, thank you very much for joining us. Ensure to join us on the next episode. So how would you know? Make sure to click on the notification bell so you know when we drop another content. My name remains Jennifer Chukwu, and my special guest,
Dr. Michelle.
Thank you.
Bye.
Bye.